Hey, I want to talk to you about a common problem and some uncommon solutions. I have a really good friend, and his wife had a urinary tract infection, or thought she did. So urinary tract infections, for doctors who do family practice, general medicine, gynecology, they see them all the time. That means that usually a woman, because men rarely have urinary tract infections unless there's something way more serious going on. So I'm basically not going to deal with men's urinary tract infections because it's a more serious problem. In women, the urethra, the spot that goes from their outside to their inside of their bladder, is very short. So it's easy for women to get urinary tract infections, so they get them a lot. Women, when they're younger, they will get them once in a while just as they hit puberty because of all sorts of things that are going on that are new to them. And so that's kind of a different thing, and it has to do with wearing cotton underwear and things like that. So that's a great place to start. Cotton underwear, not synthetics. That tends to make less irritation in that area. But for urinary tract infections that are typically occurring, women will have a little burning, there'll be a little discomfort. Sometimes they feel a little fullness right above their bladder area, right above their pubic bone. Very rarely they'll feel it in their back towards their kidneys. Way more serious infection. That's not a bladder infection, but that's way up in the kidneys. That's part of the urinary tract. Chills, fever, shakiness, that's serious stuff. So alternative treatment for that, I really think it's a bad idea to even think about that without seeing your doctor first. See your doc, make sure that that's okay, you're not having a kidney infection. That can be life-threatening, big deal. So I'm talking more about that basic garden variety, little burning, little irritation. That can be a whole bunch of things. It can be an infection. It can be what's called cystitis, which means like the bladder's just a little bit irritated, or it can be urethritis, which means that little tube that carries urine from the bladder to the outside is irritated. It doesn't mean you're infected, but lots of times women get antibiotics for that. So they wind up being on a bunch of different antibiotics for a problem that doesn't even need them. So the way that you find that out is you pee in a little cup and you get a urinalysis, and it shows if there's infection. White cells, nitrates, nitrites, those kinds of things that are part of bacterial metabolism, they'll show up. So if they're not there, you don't need to take antibiotics for it necessarily. The only way you can do is to do a test. They have those strips at some CVS, Walgreens, those kinds of pharmacies, and that's fine. It's a great place to get started. And then alternative treatment to urinary tract infection means not necessarily drugs. But you don't want to be guessing about this stuff. If you have any questions and you're not clear that this is not a bad infection, you got to see your doctor first and get checked. It's a simple check. You pee in a cup, they check it. They may do blood work, but usually it's not necessary. And then if they give you an antibiotic and say, it's sketchy, maybe you do, maybe you don't, then you can decide, well, do you want to do an alternative for a little while? That's up to you and your doctor to make that decision, but ultimately that rests with you. So people use cranberry extract. That's used a lot. Cranberry extracts, they're okay. They can work only if it's really early. Later on in an infection, they tend not to work and you need an antibiotic. The way you can tell: fever, chills, burning pain, stuff that doesn't get better with a day or two of cranberry extract. There's lots of other things that are used as well. Besides drinking about a gallon of water a day, which of course that's simple and brilliant, you can use silver extracts, nanobacterial silver, colloidal silver. They're really strong and pretty potent antibiotics. And the cool thing is, all your body does with all those things is concentrated in your bladder. So when you urinate, you really send a concentrated stream of that material out. Then, if that gets better, you're kind of in a good place. And then you want to stay careful about avoiding things that would cause urinary tract infection, like wearing synthetic underwear, having just the kind of diet that would cause your body to not function at its best, lots of sugar, things like that. And if you are somebody who likes to take baths and that kind of stuff, you want to get in, get out, and get dried off real quickly, and don't stay wet for very long. So all those things lend themselves to having your urinary tract infection get better fast. And my buddy who asked me about his wife said, well, what do I do about it? I said, get her checked out, get a dip strip at the doctor's office, make sure it's not an infection, or come to my office, I'll be happy to do it. And then if it's not a serious infection, you have all the alternatives in front of you. Avoid spicy foods, lots of water, cranberry extract, silver extracts, all sorts of herbal medicines that are specifically designed for that. There's even over-the-counter products like Azo Standard and things like that you can do. But you shouldn't take antibiotics haphazardly for any kind of infection, especially urinary tract infection. And get with your doctor with all this stuff, because they can proceed to be something more difficult than just a little simple problem. And remember, you take care of the alternative stuff working with your doctor, because we're better together.